nephrologist from the Hermina Hospital, Jatinegara, who joined us in the studio this morning. Good morning, doctor.
Good morning, Doc.
Okay, now
Thanks for being here.
let's talk about a Bell's palsy.
Okay.
Yes.
Well, some people might misconception about this. Some people say, oh, it's similar to stroke, but it's not.
Yeah, it's similar.
It's similar, but it's different. So please tell us more about what is actually Bell's palsy.
Okay, so the first thing that we have to know that palsy itself comes from paralysis or weakness, and Bell's palsy is the weakness in our facial nerve.
Okay.
Facial nerve supplies the facial muscles which control our facial movements, like the eyes, the blinking, the sensing, and also the smiling. And hence, sometimes stroke also having manifestation like that.
Right.
But there are another manifestation usually indicating that it is more like stroke rather than Bell's palsy.
Oh.
And Bell's palsy itself is the disease in the peripheral nerve, where the stroke is the disease in the central nerve disease. So it's kind of different.
What's
in
the difference between those two? Oh, the location.
The location.
Okay.
The Bell's palsy is the peripheral nerve disease on the facial nerve, on our seventh cranial nerve, while the stroke is the disease in our brain or our brainstem.
Okay.
So it's different in the location itself.
Yes, yes, yes.
So we were looking it up earlier as well, because it's a bit confusing at first. There are certain things that can cause Bell's palsy, correct?
Yeah.
What are some of those things that that can actually trigger this?
Okay, so actually Bell's palsy have no exact cause until now. It's not really understandable, but there are some factors that associated with the Bell's palsy itself, like the diabetes mellitus or the high blood pressure, or in pregnant women.
Really, pregnancy?
Yes, some people, pregnant women have 3 times more risk than normal women for Bell's palsy.
Okay.
And then infections such as like Lyme disease or upper respiratory tract infections, and also autoimmune disease such as multiple myeloma, sarcoidosis, and Guillain-Barré syndrome.
Okay. There's one that I read, and I read this, and it kind of like hit home to me because I had this recently. I had a herpes zoster, which is shingles, is the former normal term for it. I had no idea what it was. I had this in the start of the pandemic, and I was warned because my brother-in-law was a doctor. I couldn't visit a doctor at the time. I sent him pictures, and he said it's near your neck and your face. He's like, it's kind of usually on your body.
Fully.
I did. And I still have some scars, and it still have some nerve kind of like lost, like when I touch my right side. But my brother-in-law at the time said, please be careful, because if you get that shingles near your face or head area, it could cause other things like loss of hearing, loss of sight, or even Bell's palsy. Is this true?
Yes, that is right. I mean, they call it, it comes from the shingles, it calls the Ramsay-Hunt syndromes.
Right.
Kind of similar, but different because the etiology is clear from the virus itself.
Right.
But when it damage or attack your, specifically the 7th cranial nerve or the facial nerve,
That can happen. Scary. And what about the Justin Bieber thing?
Yes.
Is that all somewhat related?
Bell's palsy?
That's, they said it's Ramsay-Hunt syndrome.
Ramsay, that's right, Ramsay-Hunt. But it's very similar, isn't it? He lost kind of like his muscle, but it came back, but temporarily on one side of his face.
If the Ramsay-Hunt syndrome affecting the 7th cranial nerve, it's damage the facial nerve. Yes, it's kind of similar.
Oh, okay. So, what should we do, doctor? Since you mentioned there is no specific trigger someone who can get Bell's palsy, but probably doctor assuming people who probably have a high blood pressure or diabetes issue or something like that, or can someone very normal can get the Bell's palsy or something like that?
Yes, of course, because mostly it's idiopathic. So
What is
idiopathic is like there's no exact cause. We don't really know the etiology. There's no infection known, no tumors known, no vascular relations known, but suddenly the patient just get that.
Because I have a friend that I told you, I have a friend that he do the shooting all the time for the film. And then suddenly he got that. He got the Bell's palsy, and then attacking his one part of his face, and then it's like a stroke, and then he do for acupuncture or something like that.
Did it work?
Basically, but it works, but it didn't recover for
Really?
100%.
Oh, yeah.
Okay.
Please mention about that.
Okay.
Can
so,
we recover from Bell's palsy?
Okay, so we have to remember that. What age is your friend?
Maybe below 40, of course.
Okay, below 40. So we have to remember that the Bell's palsy itself most commonly found or happen in young adults between 15 to 60.
Oh.
So below 15 and or above 60 is usually less common.
Lower.
And the prognosis itself depends on the severity of the Bell's palsy because every patient is different.
Okay.
We have specific grading for that severity. We call it House-Brackman. We classified that to from mild to severe. When the symptoms are severe or he or she had a severe class of the Bell's palsy, usually it takes longer time to recover. So
Okay.
80% can fully recover, but the others, like 20% of them, sometimes have remaining symptoms.
And when you say remaining symptoms, does that mean it's still somewhat visible, like a little bit of the muscle has not fully
Yes.
recovered yet, or how is that? What do you mean?
Okay, so the remaining symptoms might be the partial weakness
Okay.
or the synechinesia or synkinesis. Synkinesis is like miswiring or mismatch. So when you try to move your eyes, your
Something else happens.
yeah, your
Oh,
mouth
wow, really?
It's
That's-
like not synchron.
Yeah, the signals are crossed.
Yeah, something like that.
Oh,
That's
okay.
yes. Or there are also another patient that may have crocodile tears. Crocodile tears is when the patients try to chew something or eat something, they tears.
That's what that means.
Oh, that's sad.
I've been using this term wrong. I tell my kid if she like cries and I think she's pretending, I'm like, those are crocodile tears. So I've been misusing,
no.
I've been misusing that term. Oh wow, okay.
Oh, wow.
So that could happen.
Oh, okay.
And so for the treatment itself, actually it's curable and 80% can recover. So at the first episode, you usually got, when you go to the doctor will give you the steroids for anti-inflammations, and then also antiviral, and also analgesics if you had pain, and also physical therapy.
Physical therapy.
Physical therapy.
Okay. So we talk a little bit about treatments if it does happen, but you mentioned some of the things that could trigger this. For example, diabetes or high
Yes.
blood pressure.
Blood pressure.
Would if we control those aspects of our lives, would that help reduce the risk of us?
Yes,
being-
of course.
Okay.
Yes.
And obesity is one of these risks as well, right? If you're obese.
Yes, because obesity relates to the vascular disease, and hence it also links to the risk of Bell's palsy
Okay.
itself.
So, Doctor, how can we do or how can we help someone who get Bell's palsy
Yes.
at the sudden?
Okay, the first that we seek from the professional treatment, and also usually with Bell's palsy, you couldn't close your eyes properly. So, like when you go to sleep, they're still remaining in your eyes. It's open, and it's actually, if you didn't treat that, you can get something like corneal ulcer or laceration in the eye. It can become
lead to
another
issue.
complication.
Okay,
So what we have to do is when you have the Bell's palsy and you couldn't close your eyes properly, it's better to have eye ointment or eye drops for that. Or when you go to sleep, close your eyes with eye patch.
Yeah. Yeah. Okay,
So
that's
it
what that's
helps
for.
your eyes to still get moistened, and you didn't get the laceration of the cornea, of course.
And you mentioned about how, like, if you see somebody, a family member or somebody you know, or even ourselves, happening to, first of all, how do we distinguish whether this is not a stroke? As opposed, because obviously stroke would require a lot like emergency measures.
Right.
And secondly, I don't know if I'm looking at that. We did some research before the show, and I saw that when you're diagnosed with Bell's palsy, it's like you immediately need to get help. Like when it says immediate, like how urgent is it that we get help right away?
Okay, so this is important, and how to deal with this? We can see it first from the age itself.
Okay. Age of the person.
The age of the person is not really specific, but sometimes when the person is younger, around the age of 15 to 60, maybe we can think about the Bell's palsy, but if the patient is older, maybe we can think about the stroke. Although stroke is now happen also in a young age.
Notice that.
Yeah, now
True.
it's also happening in age, but we can think that first is the age. And then second one is the time course.
Okay.
Stroke is a vascular disease which happen immediately. Acute from minutes to from seconds to minutes.
Okay.
So it's that sudden like that. While Bell's palsy is occur in minutes, hours to days. Like 48 hours to 70 hours, it can worsen.
It slowly starts to get worse.
Yes,
it's not
so
immediately.
slowly.
I see.
Although it's usually like that, but sometimes stroke can get worsened also.
Yes,
But
yes.
when it goes slowly, we can think first about Bell's palsy rather than the stroke. And the third is the most specific thing is because the Bell's palsy comes the peripheral nerve disease, and the stroke comes from the central nerve. The weakness is kind of different. When the Bell's palsy attacks you, you couldn't raise your eyebrow. It's hard to close your eyes, and you couldn't smile properly. But when you got stroke, the facial weakness that you had is only you couldn't smile properly, but you still can raise your eyebrows.
Okay.
that's
And it's affecting
difference.
other parts of that same
And
side,
also
correct?
it's affecting the side of your body, or maybe numbness of a side of your body, or maybe you're having another symptoms such as like
Difficulty
dizziness
breathing.
or loss of balance or something like that.
Okay.
Wow. Yeah. So definitely
we
need to be aware.
Need to be aware, exactly. Can we prevent that? Can we prevent for not getting Bell's palsy?
Okay, so because the Bell's palsy itself have no exact cause, it
Trigger.
also have no exact prevention, but some literatures and say that probably some like vitamin C or zinc or magnesium could prevent you from getting the Bell's palsy, and also the controlled primary disease like the diabetes and hypertension also could reduce the risk.
See, I'm always telling you. I always say, right? Check your
we
glucose,
have to
check your blood
our
pressure.
basic check. So, okay, this is very important for us because there is no specific trigger to get Bell's palsy, but everyone can get it.
Yeah, I take zinc, by the way, every day.
Oh, yeah.
Now I know there's another added benefit.
Add more
from taking it.
vitamins then. Thank you so much, Doctor.
Doc, thank you so much. It's been a
Thank
very
you.
insightful look at Bell's palsy, and we hope that you found this discussion insightful as well. We will take another short break here on the program.
Yes, don't go anywhere. We will come back with Archie. He will cook with Chef Fania.
Ooh.
Don't go anywhere. Thank you so much, Doctor.
Thank you, Doc.
Welcome.
Appreciate it.